Hip osteoarthritis or hip arthritis is very common in patients. Typically, it's a combination of small injuries over time. Occasionally, patients do have things like fractures or injuries which can kind of speed up the process. Also, occasionally there are conditions where the blood flow can be compromised to the femoral head or the thigh bone, which can cause some early onset progression of arthritis. For a total hip replacement, typically what we do is we remove the femoral head, which is the ball part of the hip joint, and then we replace that with a metal stem that goes in the femur, which has a metal ball in it, and then there's also a metal cup that goes inside your pelvis with a plastic liner. And so essentially we changed it from being bone-on-bone arthritis to metal and plastic, and get rid of that rubbing and grinding and that significant pain that patients have associated with the arthritis.